Yeah, so that was the amino acids. I also wanted to talk about the mineral deficiencies. Could you talk about the lack of minerals in the soil or lack of minerals in a diet or lack of minerals due to gluten causing people's joints to become weaker, cartilage to deteriorate, which then causes them to have surgery, in some instances due to like sports injuries or whatever. Then they get put on opiates such as oxycodone to cope. That's happened to my buddy, and then he got in a bunch of trouble. Could you talk about how they can find their way out if there's a deficiency in nutrients and minerals, and how they can fix it from a functional medicine standpoint?
Absolutely. So, mineral deprivation and mineral deficiency is pretty prevalent in the average American diet, and largely because most people, again, overconsume carbohydrates. And we know that high sugar, high refined diets actually cause loss of minerals through the urine. So even if there were minerals within the diet itself, you actually burn through more of them in an effort to try to metabolize those carbohydrates. Perfect example would be magnesium. Magnesium is lost with aggressive carbohydrate consumption. Zinc is lost with aggressive carbohydrate consumption. If we're tying this to kind of latent stage, what happens when a person has a poor diet with mineral deficiency? They can develop pain syndromes. I mean, magnesium is the body's natural muscle relaxer. And so chronic magnesium deficiency leads to cramps, leads to muscle spasms, that leads to compression of joints. And it predisposes the individual, whether they're an athlete or not, it predisposes them to injuring their joints because when your muscles are tighter all the time, and then you go to try to use them, you run a greater risk of sprains and strains. You run a greater risk of cartilage degradation because of those extra forces and pressures that are being put on the joint. So the next step in modern society today is, let's not figure out why, let's just mask the symptom. You go to a doctor in a traditional medical allopathic model practice and you go to the doctor with pain or a strain. And the first thing they're going to say is, here's a non-steroidal anti-inflammatory. Here, take some ibuprofen. That's kind of an entry drug, right? When that works a little bit, but it doesn't fix or resolve the actual underlying issue, then they pull out the big guns, right? And some of the big guns, a lot of times the big guns are steroids, steroid injections or oral prednisone or oral corticosteroids. And then when those things fail, they go to the opiates, they go to the heavy hitters, the narcotics. And that's unfortunate because, again, the underlying reason the pain exists is not narcotic deficiency. It's not steroid deficiency. It's not non-steroidal anti-inflammatory deficiency. It has a lot more to do with the nutrition. And if the person's diet were sound, sometimes all it takes is magnesium, or sometimes all it takes is zinc, or sometimes all it takes is calcium, or a combination of those. And we're just really being very surface here, Carson. This is magnesium, calcium, and zinc are just a few minerals, right? There's so many different minerals that we could talk about in relationship to this. We could talk for hours and hours and hours about it.
Yep.
But my point is that mineral deficiency can lead to degradation of those tissues. It can lead to degradation of muscle. It can lead to degradation of joint structures, cartilage, which causes chronic pain, which then leads to medication, which then contributes to the risk for the development of addiction. And so here you are now addicted to this medication to treat the pain, when in fact, all you really ever needed was to understand why the pain was there in the first place and to address that. And that's just not something that's commonly done in medicine today.
Yep. Yeah, I remember listening to one functional medicine doctor, and he said he was supplementing. He was coaching his kids' hockey team, and he put them on manganese and to strengthen the tensile strength in their ligaments and tendons. And he said hardly any of his kids got injuries, and like all the other teams, they always had people injured and ligament tears and stuff. So yeah, that's just scratching the surface. We could go on a bunch about all the different mineral deficiencies. After doing some research, I found that some natural painkillers, anti-inflammatories, are DMSO, benfotiamine, stinging nettle root, vitamin D, willow bark, cod liver oil, magnesium, and turmeric. Would you elaborate on any of those or add any or take away?
I will make a distinction between natural pain relievers as a solution
Mm-hmm.
versus natural things that you can take to solve the problem. And here's what I mean by that. There's allopathic medicine, which is take the chemically related medicine to block your own chemistry to suppress the symptom.
Mm-hmm.
Then there's what's called green medicine. Green medicine, an example of that would be take white willow bark
Mm-hmm.
as a natural non-steroidal anti-inflammatory to relieve your pain.
Mm-hmm.
And but it still doesn't solve why the pain is there. So
Sure.
again, the delineation is green medicine's fine. It's less toxic,
Mm-hmm.
but it still doesn't solve the underlying origin or root of the pain. And
Right.
so if we really want to look at natural pain relief,
Mhm.
you have to start with the diet, because most of what people eat in terms of their food is inflammatory.
Mhm.
Saturated fats that are derived from the hydrogenation process, not your natural coconut oils or your palm oils, but I'm talking about your man-made oils, right? Your man-made vegetable oils that are saturated are
Mhm.
extremely inflammatory. The
Yep.
glyphosate, as you mentioned earlier, the pesticides are extremely inflammatory.
Yep.
The heavily processed foods with added chemicals can be extremely inflammatory. And research has documented all of this and backed all of this up. So, as opposed to trying to grab for a natural agent to reduce your pain, grab for real food. Start with that fundamental first. Eat real food,
Yeah.
because a lot of the natural solution to the problem is in the diet change itself. And another example of that would be gluten. Gluten, as a general rule, a lot of people have a gluten sensitive issue or gluten sensitivity issue, and gluten is notorious protein for creating chronic inflammation and autoimmune pain. So it can create autoimmune inflammatory diseases in the joints, muscles, tendons, ligaments, soft tissues.
Mhm.
And no matter how many drugs or no matter how many natural products like turmeric or white willow or anything else that you take, if you don't change your diet,
Mhm.
nothing's going to help you.
Right.
You're going to get a temporary relief only. Now, let's say you're changing your diet and you're still hurting and you would like to have some temporary relief as it takes time for that diet to change. What are some things that a person could really focus in on doing? Really, in my opinion, there's two substances that bar none work best for pain, and one of them is vitamin C. And
Mhm.
vitamin C is a natural anti-inflammatory. It's very, very potent. And from a quantitative perspective, so how much vitamin C, we're talking about like an average 100 to 150 pound human. you know we're not talking about 200 milligrams of vitamin C. We're talking about upwards of 5 grams of vitamin C to
Mhm.
have good effect.
Mhm.
Okay. And if you mix vitamin C with quercetin's a natural plant derived bioflavonoid. It's commonly found in green tea, onions, apples, and other foods. But about 5 grams of quercetin simultaneously. When you combine vitamin C and quercetin, we actually have a name for that. We call it a steroid bridge. And the reason why is a lot of people that are on steroids and find themselves struggling to get off of the steroid due to pain. We
Mhm.
combine vitamin C and quercetin in high doses as a bridge to help them wean off their steroid. And it's a very, very effective way to help them move in that direction.
Yeah. Yeah, that's great. Yeah, I take stinging nettle root, quercetin, and N-acetylcysteine every morning, and I've had chronic allergies my entire life. But ever since I started taking that mixture, I haven't had any problems. Would you recommend Camu Camu for a vitamin C source, or no?
I recommend purely um, reduced, meaning not oxidized. So what does that mean? That means a lot of your vitamin C products are oxidized,
Mhm.
and they're oxidized by the nature of the way they're produced. So they produce them where they're exposed to air, light, and water. And so what you get is you get a vitamin C that's less potent. So the proper way to take vitamin C, I mean, camu camu is fine as a food. Berries are fine as a food. But if you're taking supplemental vitamin C, what I would really recommend is fully reduced ascorbic acid buffered with minerals.
Okay.
Okay. You buffer it with minerals so that it doesn't upset the stomach.
Mhm.
And so you buffer it with minerals like zinc and magnesium and potassium, etc. And the way we produce our vitamin C is under what's called a nitrogen blanket. So we use nitrogen as a blanket to prevent the vitamin C from oxidizing. So it prevents it from breaking down and becoming oxidized. That way, when you get it in powder form, it's fully reduced and it's not half used up. Because otherwise, what happens? You think you're taking 3 grams, but you may only be taking the equivalent of 1 gram because a big chunk of what you're using is actually oxidized. So it really is hurting you more than it's helping you.
Okay. Does liposomal vitamin C, do you recommend that or no?
I don't, and not because it can't be effective. Liposomal, there's some great research on liposomal vitamin C, but the reason I don't recommend it is because gluten is so pervasive in addiction, in the field of addiction. I've not yet met a person with drug addiction that wasn't gluten sensitive.
Mhm.
Now, that doesn't mean they don't exist, but I've not seen it. And that being the case, these liposomal products are corn. There, a lot of them are corn derivative, and a lot of your vitamin C in general is derived from genetically modified corn. And so what they're not telling you is that this vitamin C might have glyphosate residue, right? So it's important that the source of vitamin C is not only organic,
Mm-hmm.
but it's also not corn or grain derivative.
Yeah. Yeah. Yeah, I was wondering if you could talk a little bit about that too, because I noticed like my health got way better after I got off the gluten mimickers. So like a lot of people say they're gluten free, but they're still eating like rice and corn, all these things. And I was wondering if you just talk about how that can be causing the inflammation as well, causing the chronic pain.
Yeah. So, the definition of gluten, the accepted definition of gluten in the food industry today is that it's the name of the protein gliadin. So gluten, when we talk about gluten, is really, we're referring to a protein called gliadin. And gliadin is found in wheat, barley, and rye. And so the food definition is if it's wheat, barley, and rye free, down to 20 parts per million, then we can label that food as a gluten-free food. But that is actually the governmental definition is actually incorrect scientifically. And that's where the problem comes in, because corn, as an example, has a form of gluten called zein. And there have been a number of research studies that show that that form of gluten is actually just as toxic as wheat gluten.
Mm-hmm.
We've seen similar studies on rice. And so a lot of your gluten-free products, for example, are made from corn or rice.
Yep.
And they're being labeled as gluten-free, even though technically they're not really truly gluten-free. They're gluten-free based on an antiquated definition that the government uses, which again, in my opinion, is very incorrect. But you also have other foods that can mimic gluten. So there's foods that contain gluten. They just don't contain the traditional gluten that we call gliadin, but then there's foods that can mimic gluten.
Mm-hmm.
One of the biggest is one of the biggest is dairy.
Mm-hmm.
The casein, especially in the modern dairy that's produced today especially from our cow herds. So our cow herds today, most of them produce what's called A1 casein, which is a type of casein that very much resembles gluten and can create the same types of symptoms.
Yeah.
One of the other big gluten mimickers that I see as pervasive is called meat glue, otherwise known as otherwise known as tissue transglutaminase. And not tissue transglutaminase. I'm sorry. It's microbial transglutaminase.
Okay.
And microbial transglutaminase is a pink slime derived from bacteria.
Yeah.
There's a species of bacteria that we produce this slime from, and what it's used for is it adds texture and it gels food together. So like if I wanted to make a hot dog or bologna or something like that, I would use this bacterial pink slime with the meat, and we would make a preformed piece of meat, right? And what one of my colleagues, Dr. Aaron Lerner, has been researching for a number of years is the fact that this meat glue actually contributes to the same type of problems that we see in somebody with gluten exposure, right? Somebody who has a gluten sensitivity, who's eating gluten, we see the same kinds of symptoms that we might see if they're also eating meat glue. So common sources of meat glue, aside from processed meat, oftentimes your yogurts and dairy products and ice creams and confections and imitation crab meat. These are all sources of meat glue. And again, if you're eating those things thinking and you're trying to be gluten-free and you're trying to avoid it, but you're not aware of that, then you might actually be maintaining your illness and not knowing why.